Hello and welcome to Minnesota Home Care in Service 2023. To get started, we're going to go over a few notes, and then if you have any questions or concerns once we are done with the in-service, you can always give us a call here at the office at 218-963-8899, or you can shoot us an email at tgetty@brainerd.net. First of all, if you have a new address or email, please make a note of it for us. If your client has had a recent address or phone number change, please let us know about that as well. Also, if they've been in the hospital recently, we would like to know that. Make sure you're documenting that stuff on the back of your time card. If they have a fall, a change in condition, or if they end up in the hospital, we need to know about that. You can either call the office or you can document it on the back of your time card. Make sure you're watching your emails for that monthly in-service training and reading material. It's just some more in-depth training, and if you have any questions on it, you can let us know. We are going to have everybody get signed up for HHA Exchange, which is the app that we will be using to do the electronic time cards. We do not have everybody going on it yet, but we would like to get all of the employees at least signed up into the app and ready to go so that we can slowly have everybody start using it. There are directions for that, so make sure you go through the directions, and then when you get your caregiver mobile ID, make sure you either email it to us or call us with that so that we can get you set up in the HHA Exchange app, and then we'll let you know when you can start clocking in on it. And if you haven't yet, make sure you like our Facebook page. We give out updates on job openings and fun little contests that we do on Facebook. And then make sure you are only doing what is on your client's care plan. We do send out an example time card with their new care plans every year, so make sure you're only marking what is on the example time cards. And then make sure if you're sick or have any symptoms of COVID-19 that you call the office right away so we can monitor the situation and see if we need to get you covered. If you are taking care of somebody that has COVID-19 or is sick, we do have extra PPE here at the office. We have gloves, masks, hand sanitizer, gowns, any of that stuff that you might need. So if you need any of that, just let us know. Also make sure you're washing your hands good with soap and water or using hand sanitizer. Make sure you're wearing appropriate clothing at work. Make sure you're covering up. If you need extra t-shirts, let us know. We do have some. Make sure you're using appropriate language at work. Make sure you're not swearing even if your clients are doing it. And then make sure you fill out your time cards correctly. If you need whiteout to fix it, then just redo the time card. They need to be originals. They need to have the time in and time out. You need to initial what you are helping your client with each day, and it needs to have all 14 dates of the pay period on there. Make sure they're in the office every other Monday before 4 o'clock and correct, or they might not be processed until the following payroll. Make sure you're not going over 275 hours in a month, no matter how many agencies you work for, and you can only work up to 40 hours per week for Minnesota Home Care unless it gets prior approved by the office. Make sure you're rounding your time cards to the closest 15 minutes, and then make sure your PCA number is on the time card. If you need it again, let us know. Make sure you're signing in and out every single day, just like punching in and out. Make sure you're signing in and out every day. You must call the office and get all overtime approved. We cannot pay out overtime unless it is approved. If your client has flexible hours and you use too many and they run out, they don't get more hours. So make sure you're watching that. If you ever need to know where you're at as far as hours, you can call the office and we can let you know. We keep track of it every pay period. And again, if your client is admitted to the hospital, make sure we know about it, and you cannot claim any hours while they are in the hospital, not for homemaking, not for cleaning, not for anything. So make sure that if they go in the hospital, your time stops. We also do not take care of any pets or do any outdoor chores, so we can't, mow the lawn, shovel driveways, pick up dog poop. We can't do any of that stuff. Make sure you're always remaining confidential about your client. Make sure when you're in your clients' homes that their walkways are clear and cleaned up. Make sure if they have animals that their toys and food dishes are not in the client's walkways. And then look at the new drug and alcohol policy. Make sure you read through that and sign it and send it back in. Cannot use any alcohol or any marijuana 8 hours before your shift. So make sure you read through that and see the new rules there. And then make sure you're not on your phones at work. Make sure it's on silent if you have it on you. Do not be bringing your kids to work, even if your client says it's okay. It is company policy. Make sure you're not touching people's medications. If they fingerprint, it could be prosecuted. You can remind them to take their medication, but we can't touch their bottles. If they have it set up in a Sunday to Saturday pill caddy, we can hand that to them, but we can't touch their bottles. And then make sure if you are working 32 hours a week or more, that you are signed up for our health plans and disability plans. And if you are signed up for that stuff, make sure you're using it. If you go to the doctor, you can get $50 up to 3 times a year for checkups, accidental, and you can do that 3 times a year. And then if you have to be out short term, a week or more, you can apply for the short-term disability, and that's up to $200 a week. To make sure if you have to be out that you do use that as well. If you are not signed up for the health plan and you would like to be, make sure you let us know so we can get you signed up for that. There is an attachment going through the costs of the insurance and how much we reimburse you based on age. If you are eligible and you do not want the insurance, please let us know by signing that form, and then give the reason why you do not want the insurance, such as you already have insurance through your spouse or you have medical assistance or whatever it is, and then send that form back into us. And now you can also get paid to take care of spouses and minor children. They passed a law. It's in effect right now until November, but they keep extending it, so we're pretty sure they'll keep extending it until the CFSS becomes a law. So if you know anybody that is having a hard time finding somebody to take care of their spouse or their child that gets PCA services, let them know that they can take care of their own now. There is a hand washing form. Make sure you go through, read that, and print or type your name on the bottom of that. Go through the monthly training record and sign the bottom of that and send it back. On your baseline TB form, fill out your name, the date the form was completed, and then if you have an address or email change, you can put that on there. Mark any symptoms you have of TB, answer the questions at the bottom. Most of those should be no, and then send that back into us. Read through the fraud, waste, and abuse. Sign the bottom, send that back. And then there is also a payroll schedule for next year attached, so that you can keep track of when the time cards start, when they end, and when they're due in the office, and what day you get paid. So to start our in-service, we're going to go over the positive support strategies form. Should have an attachment for that. Basically, it's just sit down and take the time to get to know your clients, find out what makes their days better, what makes them happy, if it's spending time with family, if it's going for walks, maybe they like to exercise, maybe they like to meditate, whatever it is that gives their life positivity and happiness, find out what that is and try to help them do those things. And then try to collaborate together as much as possible. When they're doing tasks, maybe instead of just doing it for them, or if it's something they can do, instead of just having them do it together. If you guys are cooking, maybe say, I'm going to chop the carrots, how about you rinse the lettuce, or something like that. Just something small, even if working together really makes a difference. So on the bottom of the form, number 1, says always focus on what is important to your client. That is true. Number 2, it is important to support not only your client's mental health but your own as well. And that's true. 3, talk with your client and find out what kind of schedule they would like. That's true. When possible, work together with your client to complete tasks. That's true. Ways to reduce stress may include long walks, breathing exercises, and meditation. And that is also true. Now on to the Orientation to Home Care Quiz 2023. Number 1, employees must have a criminal background study with fingerprints prior to providing care. Is true. Each client must be given a copy of the Minnesota Home Care Bill of Rights. Is true. Agencies must have a system to receive, investigate, and resolve any complaints received. Is true. Persons reporting fraud or abuse in good faith are protected from any retaliation. Is true. The agency and client will enter into a written service agreement at the time of their admission. Is true. Minnesota Home Care Bill of Rights quiz. Person who receives home care services has a right to refuse services or treatments. That's true. And that just means if you go in and somebody normally gets help with a bath and they don't want a bath today, that's okay. But I would just document it on the back of their time card so that they know, so we know that they didn't want the bath today, and make sure you are not marking it as something that you helped with. Make sure you're not initialing bathing then if you did not help them with it. Person who receives home care services has the right to complain about the services being provided to a person of their choosing. Is true. Provider must always protect and promote the rights of the clients. Is true. Person who receives home care services has the right to any information in their file. Is true. Person who receives home care services has the right to be treated with courtesy and respect. Is true. Person who receives home care services has the right to receive care and service according to an up-to-date care plan. Is true. Under fraud, number 1, it is a felony to claim even 15 minutes that you did not work, and that's true. 2, you will be terminated for any fraudulent activity on your time card. Is true. On page 2, boundaries, number 1, is it important to maintain a healthy relationship with your client? True. Be sure to maintain a positive attitude with your client. It's true. 3, you cannot exchange gifts with your client. True. Under CPR, number 1, if you are trained in CPR but not confident, just do chest compressions. And that's true, and you should do those at about 100 to 120 beats a minute. Number 2, remember the acronym CAB, C-A-B, is true. Stands for compressions, airway, breathing. Medication administration. Minnesota Home Care staff is not to touch, set up, or administer any medications for clients. So number 1, the staff is not allowed to set up medications, is true. Number 2, PCA staff may pick up the medications from the pharmacy with the client, is true. We are not allowed to pick them up without the client. Number 3, PCAs cannot inject a client that needs insulin, is true. We cannot do any injections. For communicable disease, there is a video on the last page of the in-service packet. There will be some videos that you should be able to just click on the link and watch. If you can't just click on it, you should be able to copy and paste it into your browser. So number 1, washing your hands is not important if you are wearing gloves. Is false. Number 2, you should not go to work if you have a fever. Is true. Number 3, the most important thing you can do to prevent communicable disease is C, wash your hands and use hand sanitizer often. Number 4, it is good to stay current with your immunization and flu shots. Is true. Number 5, call the office right away if you are sick so we can get you covered. Is true. Under tuberculosis, number 1, TB can be spread through the air. Is true. A chest x-ray can be used to test for TB. Is yes. 3, TB is treatable with antibiotics. Is true. Caring for a client with HIV/AIDS. Number 1, good hand hygiene is important when caring for a client with HIV. Is true. You may need to wear gloves, gown, mask, and face shield. Is true. Preventing transmission of infectious agents is important, and that is true. For hand washing, there's also a video for that. Number 1, hand washing is very important when caring for a client, is true. Number 2, you should wash your hands for at least 15 seconds, is true. Number 3, you should turn off the faucet with a clean, dry paper towel, is true. Teeth, gums, and oral prosthetic devices. Number 1, a regular oral hygiene routine is very important, is true. If the client is experiencing any mouth discomfort, they should contact their dentist right away, is true. Under position placement, number 1, always lock the bed, is true. Number 2, place the client on the back with their arms at their side, is true. Under bed rails, there is a video for bed rails as well. The main thing to remember are the zones of entrapment, so make sure you read through those really well and watch that video if your client has bed rails. Number 1, it is important to understand the zones of entrapment if your client has bed rails, is true. PCAs may only operate bed rails if they have been properly trained, is true. Transfer belt, there's a video for that. Number 1, apply transfer belt over clothing and buckle in the front, is true. Number 2, you should use an overhand grasp, that is false. You should always use an underhand grasp. That's when your wrists are their strongest, is with the underhand grasp. So number 2 is false. Number 3, you should grasp the belt at the client's back for a better grip, is true. Temperature, pulse, and respirations. Number 1, Minnesota Home Care PCA staff may not check temperature, pulse, and respirations. That is true for charting purposes, but if your client is not feeling good that day, you can certainly take their temperature to see if you need to take them into the doctor or something. We just can't take it for charting purposes. Temperature measurement with an electronic thermometer. Number 1, for oral temp, place the probe in the client's mouth, is true. The thermometer will beep or show a readout when it is complete, is true. Pulse and respirations. Number 1, you should never use your thumb to check a pulse, is true. Count the pulse for 1 full minute to obtain the pulse, is true. Number 3, place 2 or 3 fingers on the palm and thumb side of the client's wrist, is true. Blood pressure. Number 1, place the blood pressure cuff snugly on the upper arm, is true. Inflate the cuff to check the blood pressure, is true. Weight measurement. Number 1, make sure the scale is balanced or set to 0, is true. Weigh at different times each day, false. You should weigh at the same time each day, usually in the morning before you've had anything to eat or drink. Height measurement. Number 1, the client should have their feet flat on the floor when taking their height, true. Number 2, the measuring rod should rest horizontally on the client's head, is true. Height measurement when they're unable to stand. Number 1, the client should lay on their side with their legs bent to take the measurement, false. Mark the sheet at the top of the head at their heel with a pencil and measure, is true. Fingernail care. Number 1, soak hands in warm water for 5 to 10 minutes, is true. Always be careful not to cut the client's skin when clipping their nails, is true. Always wear gloves when assisting the client, and that's true. Foot care. Number 1, always ask the client if the water temp is comfortable, true. Number 2, if the client is diabetic, we cannot do any nail care, and that is true, and that goes for fingernails or toenails. They have to go in and get those done because we don't want them getting an infection. Partial bath. Number 1, always check the water temp, is true. Ask and assist the client to participate in washing if they are able, is true. You should wash and rinse all body parts, is true. Tub bath or shower bath. Number 1, encourage the client to assist as much as possible, is true. If the client becomes weak, get them into a sitting position, that's true. We don't want them falling over. Assist the client with washing and rinsing the entire body, is true. For a bed bath. Number 1, always check the water temperature, true. Wear gloves while washing, is true. Always maintain personal privacy, is true. Especially with a bed bath, if they are wearing a robe or using a blanket, uncover one body part at a time, wash it, rinse it, and then put it back in the robe or back under the blanket, and then take out like another arm and so on. Always work from clean to dirty, is true. Dressing the client. On page 10, number 1, avoid force and overextension of limbs while dressing, is true. Put the clothing on their affected side first, is true. Perineal care in a female. Number 1, in perineal washing, go front to back, true. Use a clean washcloth to rinse the perineal area, true. In a male, number 1, wash area front to back, is true. Be sure to always maintain privacy, is true. Occupied bed making. Number 1, you need to wear gloves if the linen is soiled. Is true. Number 2, put soiled linen into a basket. Is true. Walking with a walker. Number 1 on page 11. Encourage the client to stand and get their balance before they start walking. Is true. Walk beside the client holding the transfer belt with an underhand grasp. Is true. The wheelchair transfer. Number 1, always lock the brakes. Is true. Always check the client for dizziness and weakness before the transfer. Is true. Always adjust the leg and foot rest for the client. True. Fall risk prevention. Number 1, many falls can cause injury. Is true. Keep walkways clear and free from clutter. Is true. Always make sure the floors are dry after a shower or bath. True. Mechanical lift. There is a video for the mechanical lift. Number 1, you need to attach the hooks to the lift to transfer them. Is true. Watch that their arms and legs are not going to get bumped. Is true. Leave the sling in place under the client when the transfer is complete. Is true. Side lying position placement. Number 1, the bed never needs to be locked. Is false. All joints should be supported. True. Always check for proper body alignment. Is true. Moving up in bed, ask the client if they're able to bend their knees. Is true. Number 2, hand or arm under their upper back and shoulder and other arm under their hip and buttocks. Is true. Always ask the client if they're to assist if possible. Is true. Moving up in bed using the lift sheet on page 13. Ask the client if they are able to assist. Is true. One hand should be at the client's shoulder level and one at the hip level. Is true. Lift with the sheet, roll close to the client with wrists up to hold the sheet, and that's true. You have your wrists and hands in that underhand position. Nutrition. Number 1, PCA should encourage well-balanced meals for their clients. It's true. Breakfast is the most important meal of the day. It's true. Some clients have a special diet they need to follow. It's true. Clients need plenty of fluids each day, such as 6 to 8 glasses of water, and that is true. Especially when it's hot, make sure they have something to drink. Feeding a client. Number 1, set the client up at least 45 to 90 degrees. Is true. Ask the client what foods they would like first. Is true. Always check to make sure the client's mouth is empty before feeding more. Is true. Offer the client sips of water throughout the meal if they can have it. Is true. Page 14, the Heimlich maneuver for kids and adults. There are videos for that as well. But make sure you get the person to stand up, position yourself behind them, place your arms around their waist, make a fist and place it just above the navel, thumb side in. Grab the fist with your other hand and push inward and upward at the same time and perform 5 of the abdominal thrusts. Repeat it until the object is expelled and the person can cough or breathe on their own. Hopefully in the meantime somebody was able to call 911. Number 1, if a person is choking, assess the situation and begin the Heimlich if needed. Is true. Have a bystander call 911 if possible. True. If the person is coughing on their own, you can stop the Heimlich maneuver. Is true. That means the airway is no longer blocked. Bathroom and commode assistance. Number 1, ensure privacy but do not leave the client alone if they are unsteady. Is true. Use gloves to assist to wipe. Is true. Assist the client to wash their hands when they are done. Is true. Emptying a urine drainage bag. Number 1, you should always wear gloves. Is true. Measure the urine, then empty the water, or empty the graduate. Is true. Number 3, be sure to rinse the graduate with hot water. Is false. You should rinse it with cold water. But if you have anything that you can clean it out with, vinegar, bleach, something to clean it out at least once a week would be good. Dealing with Alzheimer's and dementia, there are videos for each stage of Alzheimer's on the last page. Number 1, there are 3 stages of Alzheimer's. Is true. Number 2, all clients do not go through the same stages. Is true. If the client's behavior can be redirected, do so. Is true. Demonstrate ways to modify behavior in response to client behavior. On page 16, number 1, always respect the client's personal space. Is true. Minnesota Home Care does not allow the use of manual restraints. Is true. Follow individualized strategies in the client's plan to help them calm down. Is true. Call 911 if there is a risk for injury to the client or anyone else. Is true. Ignore the behavior if there's no risk to self or others. Is true. Behavior intervention. There's a video for that as well. Number 1, call 911 if the client's behavior is unsafe. Number one is true. Number 2, consistent redirection is usually effective, is true. Verbal and visual cues are often more effective than just verbal cues, is true. On page 17, number 4, frustration can be decreased by allowing adequate time to calm down, is true. The PCA staff is having trouble handling behaviors, they should be terminated, that's false. We help you come up with a plan. Number 6, safety is very important with behavior issues, is true. Use of manual restraints. Number 1, Minnesota Home Care does not allow the use of manual restraints, is true. Number 2, call 911 if there is a risk for injury to the client or staff, is true. Hearing loss. Number 1, there are 3 types of hearing loss, is true. Number 2, hearing aids may be a good option for someone who has moderate hearing loss, is true. Hearing loss does not affect speech or learning, is false. Page 18, positioning. Number 1, elbows and knees are often an area of skin breakdown, is true. Pillows are a great way to aid in repositioning, is true. A reddened area on the client is often the first sign of skin breakdown, is true. Clients must be repositioned at least every 2 hours or according to their care plan, is true. A reddened area on the body must be reported to the client or responsible party, is true. Care plans. Number 1, the care plan directs all cares, is true. The service agreement and care plan will always match, is true. Number 3, the care plan quiz must be completed by the PCA and returned to Minnesota Home Care, is true. Care plan can be found in each client's book, is true. If they do not have an updated care plan, make sure you let us know and we will get you one. Care plans may need to be updated if there is a change in condition, is true. The nurse or responsible party needs to be sure the PCA is following the care plan, is true. Infection control. On page 19, number 1, employees must wear gloves when expected contact with blood or body fluids, is true. Receiving a flu shot each year is not important, is false. Never handle needles used by a client for injections, is true. The best way to protect yourself is to wash your hands often, is true. Infections can be transmitted by air, blood, or direct contact, is true. HIV is an example of a bloodborne pathogen, is true. Solution of 1 to 10 bleach to water is a good disinfectant, is true. Under transfer techniques on page 20, number 1, how do you know what transfer technique to use for a client? A, consult the care plan. Number 2, always explain to the client what you're going to do before you begin the transfer, is true. The client should always be asked to help with the transfer if they can, is true. Range of motion. Number 1, PCAs need to be trained to provide passive range of motion with clients, is true. Always check the care plan before you perform range of motion with your clients, is true. Personal care assistant responsibilities. Just read through a couple of these. You must complete mandatory education every year. That's why we're going through the in-service packet. Make sure you're providing cares according to the care plan. Make sure you let us know or the responsible party of any changes in the client's condition. Make sure you're remaining confidential at all times. Make sure you're always respecting the property of the client. Make sure you're supporting the client in their activities and interests. Make sure you're not discussing your personal lives with the clients at all because we don't want to stress them out. Make sure you give us at least a 2 weeks notice if you're going to leave employment. Make sure you document all hours worked and that it's verified and signed off on by the client or responsible party. You may take a 10-minute break after 4 hours of work, and please don't be using your cell phone at work. Number 1, education needed to be employed by Minnesota Home Care is required every year, is true. PCA schedules are determined based on what the PCA wants to work. False, it should be based on the client's needs. Number 3, PCA staff must read and understand the care plan and provide cares according to the care plan, is true. Confidentiality is mandated, includes even talking with your spouse, is true. Number 5, clients or responsible party must verify all hours worked, is true. PCA may add hours to their time card they did not work for gas money, that's false. 7, PCA staff can take a 10-minute break after 4 hours of work, is true. PCA staff should sit on their phone and text and call people when they're being paid to work, is false. Emergency preparedness. Number 1, each client must have a backup person in place in case of an emergency, is true. There are ways to be prepared for emergencies such as having extra food on hand, is true. Number 3, a communicable disease outbreak such as COVID-19 can be an emergency, is true. Number 1, call 911 if you have an emergency, is true. Number 2, stay on the phone until the operator hangs up, is true. Number 3, notify Minnesota Home Care if an emergency occurs, is true. Fire prevention, number 1, always make sure your escape routes are clear. It's true. 2, report any fire hazards that you see in the client's homes. True. Number 3, make sure outlets are not overloaded. True. Home care complaints, number 1, there's a home care complaint form in each client's book. That's true. Number 2, you can always call Minnesota Home Care with any concerns at any time. You can also email us. That's true. Cultural communications training, there is a video with that as well. The questions are going to be on page 24. Number 1, federal financial assistance may not restrict service or aid based on race, color, or national origin is true. Number 2, our own beliefs should never affect how we provide care to others is true. Each person's cultural identity is unique is true. Effective communication is necessary to be culturally competent is true. Vulnerable adults training, you want to read through all of that and make sure that you understand that you can report any questions that you have about the care of a vulnerable adult to Minnesota Home Care. You can call us and we can go over it with you. If you need to place a vulnerable adult's report, we can help you do that. Number 1, all employees in Minnesota Home Care are mandated reporters is true. Number 2, reports can be made to Mark 24/7, 365 is true. Involuntary seclusion is considered abuse is true. Maltreatment means abuse, neglect, or financial exploitation, and that's true. Number 5, a person receiving PCA services is a vulnerable adult, and that's true. Then under that is the list of all the videos that you can watch. Again, you should just be able to click the link. If you can't, you should be able to copy and paste the link into your browser, and it should bring the videos up all on YouTube. On the last page, read through the concerns and acknowledgments page. Make sure you fully understand that. It's all stuff that we went over earlier already. And then the main thing is just to make sure that you understand it is your duty as an employee of Minnesota Home Care to remain confidential about any information that has to do with the clients, and you take care of the clients as outlined in the HIPAA rules and regulations, and that you follow their care plans. Again, thank you for listening to the Minnesota Home Care 2023 in-service. If you have any questions or concerns, please let us know. Thank you.